Okay. So, hello everyone. We're just going to make a start now. So, just brief introductions. So, as I've said, I'm Robbie. I'm a third year at Newcastle. And I don't know, I suppose my interests at uni, quite like triathlon, quite like little bits of research, and yeah, I like medicine. It's good crack. Just starting clinical placements, and obviously everyone's in lockdown at the moment. So at the moment, I'm working as a healthcare assistant in Cardiff, which is where I'm from. Just to get some clinical experience. So that's a very brief introduction to me.
I'm Lucy. I'm a second year medical student at Cambridge. Though I think now, because of how lockdown's cancelled all of our exams, I think I'm actually a third year now, so I might need to change up this PowerPoint. I applied to medical school, I think I was 17, so 2017 I applied. I applied to Liverpool, Exeter, Cambridge and Leeds, and I got all 4 of my offers. And that was quite a wild journey, and so I remember doing lots of wider reading like you guys must be doing now, and it was a really tough process, but I think I really enjoyed it as well. And now I'm at medical school. It's really, really fun, even though that we're in lockdown, and even though I can't go back, and I'm supposed to be at uni now actually, and even though I can't go back, I'm still enjoying it. We've got lots of online lectures and things, so that's been a bit of a learning curve for everyone, I think, transitioning to online learning. But yeah, I'm enjoying it so far, and I hope you guys will enjoy this webinar. If you do have any questions or any problems throughout, just keep messaging on the chat. Both Robbie and I will be able to look at it and try and help you out if there are any problems. Okay? Right. So the aims of these whole enrichment supervisions are supposed to be 24. It's supposed to guide you throughout your application with your wider reading. So everyone knows that you have to do wider reading to support your medical application, to sort of demonstrate that you have an insight into medicine. But the other thing that these enrichment supervisions will do is supposed to help you increase your confidence in discussing these different aspects of your wider reading, because that's what you're going to be asked to do at interview. So I think the best place to start building up your confidence is probably on here and talking in this group. And hopefully, throughout all of the wider reading that we'll be doing with you, you'll be feeling a bit more prepared for life as a medical student and as a doctor as well. Okay. There you go, Robbie, sorry.
No, that's fine. So I suppose the first thing that we wanted to kind of introduce is the concept of wider reading and why it's important, not just for kind of the raw application to medical school, but then also kind of just for wider interest and beyond medical school. And wider reading is really important even as a medical student and then as a doctor, because that's how you kind of develop almost a specialty or a specialty interest. And that's how you really become a really good holistic practitioner. I'll talk a little bit about what that means in a minute. But these are just a few of the things that we're going to cover in this lecture series and webinar series. And these are some of the elements we think are important. But if there are elements that you would like to discuss, we're very open to having a discussion about running a session on something that you would like to talk about if you wanted to.
Yeah, so some of the big things that we thought would need discussing is NHS structure and significant medical organisations. So who is what are the BMA, who are the GMC, all these sorts of things that everyone always mentions, but you never really find out who they are and what they're doing. There's always a lot about medical ethics. I know we're thrown all sorts of medical scenarios at medical school and expected to apply those 4 pillars of medicine that you're supposed to learn when you're applying to medical school all the time. And so one of the things that I've actually really enjoyed about medical school that I hadn't explored during my application was the social context of health and illness, and how the inequalities between our society, from working class backgrounds to the very rich and the very poor, how that can affect health. And that's really interesting. And of course, you're probably all thinking about the elephant in the room, that's coronavirus. So hopefully in the future we'll be able to do one of those as a supervision topic, because that will definitely be coming up in interviews for years to come. So I hope you guys will enjoy that when we do it. And if you do have any more suggestions, as Robbie said, just let us know and we'll be more than willing to have a think about how we can do this on a webinar for you guys. Yeah, I think Robbie touched on this a bit already, but wider reading isn't just for your interview. I know that's probably at the forefront of your mind, your medical application, but it's also a lot about preparing for university, so what life as a medical student is actually like, and for things that you'll need as a doctor in the future.
Yeah, and so the initial first supervision we're going to talk about, we're going to start off quite general, quite wide, and just try and cover some of the general concepts in medicine. So we're going to talk a little bit about philosophy of medicine, and then also how evidence is used in medicine a little bit as well.
Yeah. Okay, so in this session, what we want to do is understand the way medicine is considered an art and a science. So I think that's one of the big debates that you can be asked at your interview, and also just a more general thought-provoking question that's quite interesting. And another point is whether you define how you define health and disease, and what are you really treating as a doctor, and do all people have the same definition of health and disease, because that can change how you would treat a patient. And also, we want to give you a bit more of an insight of the role of evidence-based medicine in just normal treatment of patients. So that should be quite interesting for you guys. So this is a bit of a rogue question, but I wanted to start by asking you guys these two symbols that I hope you can all see. Which one do you think is the correct symbol of medicine? Because everyone always gets it kind of confused. And I think it's quite interesting to touch upon which symbol actually represents medicine from history and which is the one that's been sort of a myth along the way. So if you guys can comment in the chat which symbol you think is the correct symbol for medicine. I'm just going to wait, and please respond.
Yeah, this was a little bit rogue. We were talking about this and having this in the lecture earlier, and quite honestly, I had no idea.
So
sorry? Yeah, I did completely wrong. I had no idea. So it's an interesting one. And
okay.
Yeah.
No, I was just going to say, so if no one, the second one, does that mean the rod of Asclepius or the caduceus one?
The rod.
The rod. Yeah, okay, great. You guys are smart. You're a lot smarter than I was. So,
and I am.
Asclepius, I don't know if you guys have ever done medicine through time and history or anything. I did when I was doing my GCSEs. But Asclepius was a Greek god of healing. So there was this myth that there was a man in an Asclepion, which was a healing temple. And he was asleep one night, and Asclepius's snake licked his eyes, and suddenly he wasn't blind anymore. So that's why there's this rod of Asclepius. And Caduceus is like a Hermes god who would help people move from our world into the afterlife. So he was seen as a carrier of death. So I always think it's quite ironic that America uses the Caduceus symbol as a symbol of medicine all the time. So that's quite a fun fact for you to share with all of your friends and in your med socks if you have them at your school. I know, it's very much reaching. I don't know why I said it was fun.
America is carrying the people to death.
I know. Okay. So, did you
want
to say?
Yeah, I'll chat about this. So this is a concept that's banded around quite a lot. Kind of, it's almost, I would view it as a false dichotomy between medicine being an art or medicine being a science. But there are definitely concepts of art and artists in medicine. And the field that comes to mind most is surgery, and particularly plastics and maxillofacial surgery, where a plastic surgeon is not only looking, and that doesn't just cover cosmetic surgery, that covers a lot wider reaching. So say, for example, burns victims will see a plastic surgeon. They are looking to either enhance a patient's appearance or restore a patient to normal, or as close to normal as they can get. And that's, that is off the surgeon's impression. That is off what both the patient and the surgeon view as normal and view as good. And that is an art form in itself, and kind of different surgical practices and some areas of medicine as well do have elements of art in. I suppose one of the other side, kind of another concept about that is thinking about medicine as a science, where you look at, say, for example, cardiology or respiratory medicine. From my experience, it's much more function-based where you are looking to get to a predetermined outcome clinically. And there's a lot of good science out there which shows that if you do this, you will get this outcome. And I suppose what I'm trying to say is that there are kind of different variations of how much medicine is an art form and how it's open to interpretation versus how much medicine is a science. And you look at people and you look at their results and you implement that as a science, and then you find a treatment based off those numbers.